All right, so this is a non-nociceptive input technique, and all that really means is that we're trying to put input into the nervous system that does not create a pain response. And this is a really great technique for addressing the sensitive nervous system, particularly looking at getting into the biggest organ of our body, which is the skin. The skin has miles of sensory nerves running throughout the skin. And so we're going to assess the sensory nerve sensitivity. We're looking for allodynia at the skin and the fascial layer. So the basic technique goes like this. You're going to palpate around in through their area of tenderness, and you're looking for pain. If this hurts right here, if this is causing pain, and I'm not pushing that deeply, so this is what we call allodynia, you'd actually hold on to that point. And then you can do one of a number of things, is you can create a ballooning technique with your other hand until your patient says, okay, that doesn't hurt anymore. And again, you can go in any direction. Or you can create a distracting technique where you're actually taking your other hand and distracting the tissue away from the painful area. Again, until the patient says, okay, that doesn't hurt. And at that point, you're going to just hold it for about 2 minutes so that the brain gets a chance to experience touch in the area that hurts, that does not create a protective response. You can also do that within the pelvis, and so the pelvic model is here just to kind of give you an idea. But essentially with the pelvis, with internal palpation, if you are touching any of the structures around the roof or the anterior surface of the pelvic floor, generally the area that you are going to create either ballooning or distraction in is through the pubic symphysis, through the groin, or through the abdominal wall. And again, you can balloon towards your inside finger, or you can distract away. If we hold the pelvis on here for a moment again, if the inside finger is actually touching any of the sensitive structures on the lateral wall of the pelvis, generally speaking, the distracting and the ballooning can come through the adductors or the inner thighs. And again, you can balloon towards the tissues, or you can actually sink your hands in and distract away. If on the inside you're feeling any tenderness around the posterior wall or the back wall, around the tailbone, or around the puborectalis or any of the structures in the back, then generally speaking, you can balloon the tissues through the glutes on the outside, or again, distract. You can also create some ballooning or distraction through the sacrum or through the pubic symphysis to create that non-nociceptive input in the posterior wall of the pelvis. Lastly, we can also look at doing this on a superficial level. So if someone has vestibulodynia, you can touch any of the areas of the vestibule, and if you create sensitivity, you can use your other hand to again distract or balloon towards that tissue until there's no pain, and then you hold it for 2 minutes, allowing the patient to experience what non-painful touch in that area feels like.